Lepantas Leshore, native researcher, Ma Museum and Center for Indigenous Cultures. Today, bringing you the negative impacts of asbestos in Kenya. Why are we bringing this? The current CS, the current who has just been handed over by Tuya, Honorable CS Adan Duale, has really kicked the road to address key issues in this country. And one of it is the negative aspect of asbestos. Most of our schools, as you know, were built with the asbestos materials. And these materials were used in construction and insulation due to its fire-resistant properties. But again, the asbestos at this particular time has a number of negative impacts, including cancer. So today I want to support the directive by the CS, Honorable CS Adan Duale, and support this directive by giving you some of the negative impact of asbestos in Kenya. The asbestos has quite significant negative health impacts, which becoming more recognized in Kenya. But the primary issues associated with asbestos exposure include: one, health risks. Prolonged exposure to asbestos fibers can lead to severe respiratory illnesses, including asbestosis, lung cancer, and mesothelioma, are rare but aggressive cancer affecting the linings of the lungs. This condition often develops years after exposure, making them particularly very, very dangerous. Number two, environmental contamination. Improper disposal of asbestos containing materials can lead to environmental contamination. When asbestos fibers are released into the air, they can be inhaled by people living or working nearby, leading to widespread health risks. Additionally, when these materials degrade or are disturbed, fibers can be carried by wind or water, contaminating soil and water sources. So we have a number of schools built by asbestos. Once you interfere with the asbestos materials, then you expose the communities, the learners, the teachers, the parents getting into that school, the workers, non-teaching staff, and a number of other cohorts. If you are in a health facility, then it affects the healthcare providers, it affects the patients, because it has been exposed. So it's very, very important to understand that the material, once disturbed, can be carried by wind and air, affecting the general populations. Another third one is inadequate regulation and awareness. We have a very, very poor understanding of the impact and negative impact of asbestos in Kenya. And in Kenya, the regulation of asbestos use and disposal has historically been insufficient, leading to continued exposure risk for populations. There is often lack of awareness among the public about the dangers of asbestos. So in Kenya, the regulation of asbestos use and disposal has historically been insufficient, leading to continued exposure risks. There is often a lack of awareness among the public about the dangers of asbestos, leading to improper handling during renovations, demolitions, or disposal of asbestos-containing materials. I give you one example. In Olkiramati and Addison, this is one of the schools in Kajiado, in Magadi. The asbestos were removed. They were put down on the floor just next to the school, exposing the learners and teachers in this school very significantly. So there is need really for the public to understand that once you remove them, they are packed well in a special cars and disposed in Mombasa. So the only place to dispose asbestos is Mombasa, in the coastal part of Kenya. It cannot be disposed in any other county. And this is very critical information that you need to understand. Another one is, of course, the legacy of old buildings. Many older buildings in Kenya, especially those constructed before the 1980s, still contain asbestos. These buildings pose a significant risk during renovation or demolitions, where asbestos fibers can be released into the environment if not properly managed. So asbestos needs to be managed by experts, not just people waking up in the morning and thinking they can handle asbestos. It has to be handled properly and efficiently and effectively. Economic burden, again, of asbestos. The health issues caused by asbestos exposure lead to a significant economic burden, both to counties, both to national government, and both to those in charge of this. It is actually an economic burden, both in terms of healthcare costs, of treating affected individuals, for individuals, and the cost associated with managing and mitigating environmental contamination. Efforts, therefore, to mitigate the negative impacts of asbestos in Kenya include increasing public awareness, stricter enforcement of regulations on the handling and disposal of asbestos, and promoting the safe removal and replacement of asbestos containing materials in older building. So what are the next steps? As the CS has directed, all schools in the country should be able to be mapped. And we know in Kajiado County, for example, how many schools still have asbestos, how many facilities still have asbestos roofings, how many social halls still have asbestos building or roofing. We need to do that mapping as fast, jointly with the Public Health, Ministry of Public Health and Department of Public Health, NEMA, and the Ministry of Education for schools, and the Ministry of Health for health facilities. This brings collective action. And as the CS has directed, we need to do this very fast, because he wants to see this asbestos removed professionally by December 2024. It's just that the costs are going high, the impact of asbestos to people. We have quite a very high number of cancer and lungs related, and we need to move this with speed. Let us welcome the CS with its prioritization of key environmental issues and contamination issues as we move forward. Let us please move very fast. County governments, national governments, let us come together and roll out the mapping of this asbestos infrastructure in our schools, in our F facilities, in our towns, so that the NEMA in NEMA can really forge forward to give guidance on how they will be removed and disposed, so that we don't contaminate the air and water that also cows and livestock also drink. Thank you very much, and let us move with speed with the CS. CS, move with speed. We really congratulate you for getting the priority issues affecting Kenya. And thank you so much, and we support you in this endeavor to ensure that asbestos related infrastructures are removed in this country. And thank you very much.